Good afternoon, everybody out there in Facebook land. This is the Bartlesville Public Library. This is Joni Gilmore speaking to you today, and I'm so excited to introduce our speaker for today, who is Dr. Erin Paxton, Doctor of Veterinary Medicine. And she is one of the veterinarians at Arrowhead Vet Clinic in Dewey. Dr. Paxton always knew that she wanted to be a veterinarian because she loved taking care of animals and she loved science, even as a child. She graduated from Oklahoma State University with a BS in Animal Science and a doctorate of veterinary medicine. So, true passion for the animal-human bond is at the core of Dr. Paxton's practice. And today she will talk to us about preventative health care. She is here today to share tips with you on how you can help your pets live their best lives. So without further ado, I would like to introduce to you, and you join me in welcoming Dr. Erin Paxton.
Thank you so much, Joey. And thank you for everyone that's joining us today. I appreciate you taking a bit of time to sit with me and go over how to raise a healthy pet. Bear with me, this is my first time doing a presentation like this, so I am a bit nervous, but hopefully this will be very informative and you will pick up some good tips today. So to start off with, I want to just cover the basic care of your pet. That includes providing shelter, which is helping a pet be protected from the elements. That is whether it's really hot weather, very cold weather, snow, rain, things like that. It's also important that you provide food and a fresh water source every day. Food and water are definitely vital to your pet's health. The next part of our presentation will be going over preventive health care. There's lots of aspects to preventive health care, and so we're going to go over each of these individually. The first part of preventive health care is having your pet visit their veterinarian for a wellness visit at least annually. During that wellness visit, a veterinarian will do a complete health assessment by performing a physical exam from their head to their tail. The veterinarian will assess your pet's eyes, oral cavity or mouth, their ears, their hair and coat, their joints, assess the size of their lymph nodes, as well as feel for any internal abnormalities. That wellness visit is a great opportunity for you to ask questions to your pet health expert veterinarian. During that time, the veterinarian will help guide you to formulate a plan for your pet's health that will include not only what's good for your pet, but also your goals involved with your pet's health care. The first part of preventive health care is vaccinations. Vaccinations are one of the best ways to prevent diseases. Vaccinations are reliable, safe, and cost-effective. Vaccinations have come a long way since they were first introduced, and we rarely see severe reactions related to vaccinations. Vaccines not only help prevent diseases that affect your pet, but also some of those diseases that can be transmitted to people. Vaccinations are broken into core and non-core vaccines. Core vaccinations are vaccines that prevent diseases that the majority of pets are at a high risk of exposure for, have a high severity of disease, or have the potential to be transmitted to humans, such as rabies. Non-core vaccines help to prevent against diseases that only some pets may be exposed to. And that's going to be based on their age and their risk of exposure, which is based on lifestyle and their geographic location. This is important to keep in mind, as if you ever were to move away from Bartlesville, which we hope you don't, because certain diseases are more prevalent in other areas, like Lyme disease and disease, that we don't see here, and your pet may need that vaccination if you were to take them with you. Vaccinations for dogs, as far as the core vaccines, include the Syphilis, adenovirus, which is also referred to as hepatitis, parvovirus, and rabies virus. Core vaccinations for cats include the feline rhinotracheitis, which is the herpes virus, calicivirus, hand leukemia virus, as well as rabies virus. Some of the non-core vaccines, and this is not a complete list for both dogs and cats, but for dogs include leptospirosis, Bordetella, which is also known as film cough, and the canine flu. For cats, feline leukemia is considered non-core, other than for kittens when it is considered a core vaccine. Many of these diseases affect multiple organ systems and are either transmitted by direct contact with infected animals, respiratory droplets like coughing and sneezing, or environmental contamination. Feline leukemia can be directly transmitted from an infected mother to her kittens. These diseases are and often fatal. And because the majority of the diseases are viral, there's no specific treatment. And if your pet was to become infected, the treatment is aimed at managing their symptoms. Some of these diseases can also survive in the environment for weeks, months, or even years. The next topic that I'd like to discuss is parasite prevention. I've broken this down into intestinal parasites, heartworms, fleas, and ticks. There are many types of intestinal parasites that can affect both dogs and cats, including worms and protozoal parasites like Giardia and Coccidia. The most common parasites we see are roundworms, whipworms, hookworms, and tapeworms. Pets can become exposed to intestinal parasites either from their mother, so roundworms and hookworms can be transmitted to either puppies or kittens through the mother's milk. Ingesting an intermediate host, a specific sign of that is tapeworms. Tapeworms they actually can get from eating fleas, or environmental contamination. So any animal that's shedding eggs of a parasite in their feces, those eggs are now in the environment. And when your pet either is sniffing the ground, they can accidentally ingest those eggs. Even just licking their feet, playing fetch. Sometimes we don't think about the ball rolling across the ground and coming in contact with things, and then when they go and fetch that ball, they can become exposed to that, as well as direct penetration of the skin, such as hookworms. Symptoms of intestinal parasites can vary. Some pets may show no symptoms at all. Other pets may have vomiting, diarrhea, weight loss, or just overall malnutrition. The way that we diagnose intestinal parasites is by performing a fecal exam, which is when we take a sample of your pet's stool and we mix that with a solution that allows any eggs to float to the surface, and then we look at that underneath the microscope to see if we see any of those eggs. When it comes to treating intestinal parasites, many dewormers do not cover all of the intestinal parasites that you can see. So this is one of the reasons why it is important for your pet to be checked for intestinal parasites, is you want to make sure that they are receiving the appropriate treatment. The best way is to try and prevent intestinal parasites. And the way that we do that is by using heartworm preventative products that also include intestinal parasite dewormers. Some of the intestinal parasites also pose human health risks. Hookworms and roundworms can both be transmitted to people. This is quite rare for that to happen, but it is going to be more common in small children or anyone that has a compromised immune system. Heartworm disease is something that we see in both dogs and cats that is potentially fatal. Oklahoma is currently ranked 10th in the nation as far as the prevalence of heartworm disease. Our pets become infected with heartworms by an infected mosquito. Symptoms related to heartworm disease is specific to both dogs and cats. In dogs, we can see signs such as coughing, exercise intolerance. Sometimes they might have a distended belly because their belly is becoming full of fluid, secondary to heart failure, or they may show no symptoms at all. In cats, they present more with respiratory issues. So we see asthma-like symptoms like difficulty breathing, coughing. When it comes to testing, there's a simple blood test that your veterinarian can perform that can check both dogs and cats for heartworms. It is best to prevent heartworms with the use of a FDA-approved heartworm preventive product. As far as treatment, we do have treatment for dogs. Unfortunately, at this time, there is no approved treatment for cats. The treatment for dogs consists of a series of injections of an arsenic-based medication called Larceny. And during treatment, your dog must be confined for anywhere from 4 to 5 months. Needless to say, treatment is not fun for either your pet or you, and is very costly. Fleas are probably one of the most common parasites that we see in veterinary medicine. Pets become exposed to fleas from the environment. Symptoms can range from nothing, some pets you wouldn't even know they have a flea on them, to severe itching, hair loss, and even anemia, which is a low red blood cell count that you can tell by your pet being weak or having a pale gum color. Prevention is key when it comes to fleas, as one single adult flea can lay anywhere from 40 to 50 eggs a day, so they reproduce extremely fast, and it takes on average about 3 weeks from eggs to become adults, so they also have a very long life cycle. And once those eggs are in your home, it doesn't matter what the environment is like outside, you will see fleas year-round. There are many safe flea-preventive products that you can get both over the counter as well as from your veterinarian. And I definitely recommend using flea prevention year-round because we do see fleas all the time. As far as treatment, that's aimed at using some of those products that are able to kill fleas. If your pet was to have any of the other symptoms as far as itching or if they were severely anemic, they may even require a blood transfusion. Fleas also pose a human health risk, and they can transmit certain diseases like plague, tuberemia, and even cat scratch fever. Ticks is going to be the last external parasite that we discussed today. Ticks, pets are exposed to those in their environment as well. I had kind of a fun little video to show you, but unfortunately it's not going to work for us today. What we call questing, which is when a tick rests onto a blade of grass with their back 2 legs, and they wave their arms around in the air, and that is how they go about searching for their host and then attaching to them. Symptoms related to tick disease, the tick itself, you can have irritation at the site where the tick was feeding, as well as ticks do feed off the blood of your pet, so they can also become anemic from a severe tick infestation. Ticks also transmit a variety of diseases such as Ehrlichia, Lyme disease, Rocky Mountain spotted fever, and anaplasmosis. Some of those diseases also affect people. Testing for tick diseases is a simple blood test that we can either run in clinic, or if we need a more extensive profile, we can send that out to a reference lab. I think you guys are kind of getting my gist here that prevention is always key when it comes to any of the parasites. So it is best to prevent ticks from either feeding off of your pet in the first place with the use of one of those approved over-the-counter or prescription tick preventive products. Treatment for ticks is going to be using one of those products that's able to kill the tick itself, as well as specific treatment for any potential disease that the tick has transmitted to your pet, if they were to show signs of that, which can include high fever, depression or lethargy, inappetence, so not wanting to eat. They can have multiple joint pains, they can feel very achy, as well as bleeding abnormalities. So if you ever notice a nosebleed or bruising in places that you wouldn't expect it from some type of trauma. The next topic we're going to discuss is nutrition. Nutrition is really the foundation of preventive health care. Not only when our pets are growing does an appropriate nutrition allow for healthy development, but as our pets age, it can help with prevent certain diseases as well as manage some diseases. A well-balanced and high-quality diet can prevent and manage disease in pets. Also, maintaining a healthy body weight is important when it comes to nutrition and disease prevention. Nutrition is very confusing when you're looking at all the different varieties of pet foods that are available today. And sometimes pet food labels can be very confusing, and unfortunately, manufacturers can kind of skew those labels in their favor. And one example of this is any diet that lists holistic on their bag. There's actually no definition for holistic with the governing body of our food that's produced here. And so if a pet was, if you were looking for a holistic diet, just because the bag says it doesn't mean it is truly a holistic diet, unfortunately. There's also been a recent concern about the link of grain-free diets and heart disease in pets. This is something that's fairly new, but it is still being researched, so we don't quite understand what exactly it is about grain-free diets, but we have had several pets that have developed heart disease that we typically don't see in those breeds, and a common link has been a grain-free diet with those guys. The next couple of slides are just an example of healthy body weights for both dogs and cats. So when we judge a pet's body weight, we're actually looking at their body condition to see if they're at an appropriate weight or not. When you're judging your pet's body condition at home, what you're going to do is you're going to feel down their sides. So you're going to feel over their chest and their ribs, and you should easily feel their ribs. And it should feel very similar to if you were to hold your hand out when you rub your hand over the top of your knuckles. If you flip your hand over and your pet's ribs feel more like the bottom side of your knuckles or even the palm of your hand, that means your pet is overweight. Vice versa, if you make a fist and you feel your knuckles that way, that would mean your pet, if you feel their ribs in that manner, is underweight. The other way that we assess body condition is by looking down on them. And pets should have that nice hourglass shape that we all wish we had. So wider through the chest and hips and thinner through that waist area. And then when you look at your pet from the side, they should have a nice tucked up belly into that waist area. And maintaining a healthy body weight in your pet reduces their risk of developing diabetes, heart disease, joint disease, and even cancer as they age. Spaying and neutering is probably one of the most important health decisions you'll make for your pet. There's many benefits to having your pet spayed or neutered, both behavioral and health benefits. Spaying is when we remove the ovaries and the uterus of female pets, and neutering is when we remove the testicles of male pets. Some of the behavioral benefits that you can see with having your pet spayed or neutered includes reducing unwanted marking or spraying of their territory, roaming, which can lead to potential injury, aggression as well as mess related to heat cycles. Some of the health benefits that you can see for your pets include reducing the risk of certain cancers. Female pets are at a higher risk of developing breast cancer, ovarian cancer, and uterine cancer when they have not been spayed. There was actually a study that showed that if you had your pet spayed before their first heat cycle, their risk of breast cancer was 0.5%. And if you wait between the second and third heat cycle, it jumps to 25%. So it's 1 in 4 female dogs that are at risk of developing breast cancer later on. It also reduces the risk of testicular cancer in male dogs and cats, as well as lowers prostatic disease, as well as life-threatening uterine infections. Another benefit of having your pet spayed or neutered is reducing pet overpopulation. There are thousands of pets that end up in the shelter every year. And not to mention the strain on communities that some of the stray pets have, not only from car accidents, but also those animals that are spreading diseases to our personal pets and other animals in the area. Spaying and neutering has also been proven to extend your pet's life anywhere from about 3 to 5 years. This is just a little chart that shows how many cats can come from one unspayed cat and her kittens, as well as how many dogs can come from one unstable female dog and their puppies. And if you can see, in about 6 years, you're looking at around 67,000 kitties and puppies. Dental disease is probably one of the most common diseases that we diagnose in veterinary medicine. By the age of about 2 to 3, 80% of our pets will have some form of dental disease. The effects of dental disease are not limited to just the changes within your pet's mouth, which can include pain if they were to get in loose teeth, infection, and abscesses of tooth roots, but can also cause issues with your pet's heart, liver, and kidneys. Routine dental health care consists of both at-home care and professional care. At-home care can include brushing your pet's teeth, which is the best thing that you can do for them, as well as using dental-approved products like dental chews and water additives. These things should be done daily, and that should make up 70% of your pet's overall dental health care. Professional dental cleanings under general anesthesia allows us to do a complete oral health assessment, as well as clean your pet's teeth using an ultrasonic scaler and do a polish treatment. This should be done starting around 2 to 3 years of age, depending on the development of dental disease of your pet, and is typically done once a year. Although some pets, especially our small breeds, do require dental cleanings more frequently. If you can see here, not only did all this brown, black part is it able to be removed, so these teeth are nice, pearly white, but also just look at the pet's overall gum color. So you can see this side is very red, inflamed, irritated, and just after the dental cleaning, so this is a picture from before and after, same day. You can see how much more healthy the gums appear just after having the routine. Providing appropriate dental health care has also been proven to extend pets' lives. Behavioral issues are probably the #1 reason why pets are surrendered. And it's important to remember that your pet's mental well-being is just as important as their physical. Behavior and training should start at a very early age. 3 to 16 weeks is an important time for puppies and kittens to develop socially. It's important to try and expose them to not only different people of all ages, genders, and ethnicities, but also other pets. You want to do this in a controlled environment because this is also a sensitive time for puppies to be at risk of certain diseases. Exposing them to novel environments or new environments, different sights, sounds, and smells, car rides, positive handling of all their body parts is also an important part in preventing certain behavioral issues developing later on. Giving your pet environmental enrichment and play helps to minimize boredom, which can lead to destructive behavior at home. Many of our pets do suffer from anxieties such as noise phobias and separation anxieties, and it is important to know that even in our adult pets, they can benefit from behavior modification plans that are formulated by your veterinarian to help them cope and become desensitized to anxiety-driven events. I highly encourage you, if you feel like your pet is suffering from some form of an anxiety, to reach out to your veterinarian and see what all may be available to help your pet have a better emotional support. There's also lots of things you can do on the training side as far as at-home training. I like the Nothing in Life is Free method. You can Google that. As well as the Bartlesville Obedience Club offers training classes, typically twice a year, and Petco also has training classes available. The next thing we're going to discuss is preventive diagnostics. Our pets can't verbalize when they aren't feeling well, and they rely on us to be their voice. Unfortunately, many of the diseases may not manifest until a significant percentage of organ function has been compromised. As an example, kidney disease takes 75% of function loss for your pet to become ill. This means that you may not see these signs until there is advanced disease. Preventative diagnostics help us to detect internal changes early. And it's been proven that if you can treat a disease in its early stages, not only is it more successful, but it's also less costly. By starting annual preventive diagnostics when your pet is still young, this allows us to develop trends that are specific to your pet. And as we watch those trends as your pet ages, we can detect subtle changes that may still be within our normal reference range, but are abnormal for your pet and where their values have historically been. Certain breeds are also prone to some diseases, and being able to monitor for those can help detect those at the early stages in those first breeds that are prone to them. Another important time for your pet to have general diagnostics and lab work is prior to your pet going under general anesthesia for any type of surgical procedure. This helps us to assess your pet's internal health and make any changes to our anesthetic protocol, or maybe even put off anesthesia depending on how severe things were looking. Over on the right-hand side of my slide, this is just a few things that we're looking for when we do lab work on your pet. We can assess your pet's liver and kidney function. We look for changes in your pet's glucose that could indicate they may be pre-diabetic. Certain blood work changes can point towards cancer or infections. We also do assessments of your pet's urinary health and thyroid function, as well as any type of GI or gastrointestinal disease and cardiac disease. Our senior pets are definitely some of our most beloved and certainly have a little bit different needs when they get older. So our pets age so much faster than we do, and I think we all know that they're never around as long as we want them to be. And because of this, as your pet is coming into their senior stage, we do recommend that they be checked twice a year rather than once a year. It's also best that they eat an age-appropriate diet to meet the specific nutritional needs for our senior guys. Diagnostics are also key to catching those diseases that our senior pets are at a higher risk of developing. And as your senior guy ages, you might start to notice that they're having some vision or hearing loss, as well as mobility issues. So making adjustments to their home is important to help our seniors get around a little bit easier. And that can include placing a yoga mat or runner rug on any type of surfaces. If they're used to jumping up onto the couch or onto a bed, you may want to utilize some stairs for them to go up and down. Or if they are having trouble navigating stairs, maybe even utilizing a ramp. For pets that are going blind, there's a handy little device you can use that's called a halo. And they wear it, and it's this little projection that goes out from their head. And it acts as a bumper. And so they're bumping into that ring rather than bumping their face. And so it helps some of our guys that are having some vision abnormalities get around a little bit better. It's also best if you don't change your furniture around for those guys. The last thing that I want to talk about today is financial planning. So our pets provide us with fun, companionship, and unconditional love. And in return, we incur the responsibilities that go with pet ownership. Some of the things you need to plan for, as far as what you need to do for your pet, is providing that basic care, along with their preventive health care, as we have previously discussed, boarding services. So they can either go on vacation and have somebody watch your pet, or you can have a boarding facility, or if you have a family emergency that if you aren't able to take your pet with you, unexpected illness or injury, as well as those breed-specific diseases. There are several options that are out there when it comes to financial planning and payment. Many of us don't have just $1,000 or $3,000 laying around if your pet was to be hit by a car or get a torn ACL and need surgery. And so when you're looking at the different options that are out there for you to aid with any finances, there's lots of things there. So some people can certainly pay for those things at the time of service, and that's the way that they go about their pet's health care, where having a savings account, a pet savings account that you contribute to monthly to have that reserve if you were in need of it. Credit card reserves is also another way that a lot of people pay for their pet's health care. And then there's even medical credit cards like Care Credit and medical ones like Scratch Pay that are available to you if you needed financial assistance. Pet health insurance is something that's been around for a little while, but it is becoming more widely used. And there's lots of different insurance companies out there, and so I definitely recommend that you reach out to your veterinarian if you have questions over that, or even a licensed insurance agent, as they can kind of walk you through the different policies and what they cover. But there are definitely reports from the insurance companies about paying out, maybe $1,000 or $2,000 on upwards of $40,000 for a pet's medical care. And that may be the difference between your pet receiving what they need and not. Another thing that can help, some clinics offer annual wellness plans. And what an annual wellness plan does is it wraps all of your pet's preventive health care that they need into 1 year, and then allows for a couple different payment options. And one of those is typically a monthly payment. So it helps you spread that cost out over a year. So you don't have that bulk upfront payment. This last slide is from Discover.com, and it just kind of goes over some of the annual expenses that you can expect for your pet. So the cost of food, emergency visits, their kind of annual health checkup, toys, treats, grooming, like that. And with that, that concludes my discussion. So thank you so much for attending. I hope that you guys enjoyed this talk, and I'd be happy to take any questions.
Okay. You mentioned something about grain-free diets being a problem. So, because a lot of times commercial food has a lot of cornmeal and so forth in it, but and I've always heard that was not good for the pets, like my pet cat. Is that something that's actually, is that what you're talking about?
A little bit, yes. So corn is actually a very digestible carbohydrate source for pets. And, cats are obligate carnivores, so their diets typically aren't going to have as much of corn and some of those other products in them. They're going to be more heavy on the meat side, but corn, especially on the side of allergies, is actually one of the lowest things that we see as a cause of food allergy in pets. So it's a little bit of some false information when it comes to corn. Not to say that some pets don't have a sensitivity, but when we think about, especially on the dog side, when we think about how a wolf, if you kind of want to go back to what we think of as natural. Our dogs are omnivores, and so they do a lot of grazing, and when they do feed on their prey, the first thing they eat is usually the guts. And so they are consuming whatever their prey ate, which is typically a herbivore, so they're going to have grains in their natural diet as well.
Okay. So, because I've seen stuff where they say you should probably make your own pet food as opposed to buying commercial pet food.
You can make your own pet food. The biggest concern is making sure that that diet is balanced. And I think that's the hardest feat for us to achieve when we're making our own diets. I definitely recommend that you reach out to a veterinary nutritionist, and I don't remember the name of the website right off the top of my head, to get in contact with one, that they will do some virtual contacts, and they will actually help you formulate diets if you want to do a homemade diet, just so you know your pet's getting everything that they need.
Okay. You had also mentioned about getting your pet fixed and how they can help alleviate spraying around the house or elsewhere. But I had a cat that sprayed and she was fixed. Was it because she was fixed too late, or?
It could have been that she was fixed too late, but unfortunately, some pets will do that with behavioral problems. So if she was stressed, or, did you have more than one cat? Or
No, it was one cat.
Just one cat. Sometimes they'll become adverse to their litter box, so there are definitely some more of the behavioral side of things that will cause them to be spraying.
And does age play a factor in a lot of the stuff that you have on your slide?
As far as spaying and neutering, yes, so your behavioral benefits, you are gonna get a bigger benefit if they are spayed earlier on in life, so usually between 5 and 6 months of age. Some of the health benefits, kind of going back to breast cancer, that was certainly in earlier in life. There have been some studies here lately that have shown that maybe waiting can help with certain diseases like bone cancer in our large breed guys, and even some of the musculoskeletal tears that we can see in our large breed guys. So for neutering on them, it is, if you're looking for more of the health benefits, sometimes recommended to wait between 12 and 18 months, but you do kind of risk losing some of those behavioral benefits.
You had mentioned about flea treatment all year round. If you have a pet that's indoors, is that still recommended, and why?
Yes, so even in our indoor pets, we as people contract fleas and ticks and bugs in on ourselves. And if one flea gets in there, your home environment is conducive for having those fleas reproduce. So I do recommend that indoor pets also be treated year round.
If you have a pet that's fixed, does it still go through a heat cycle?
No,
Okay. Good to know.
I guess that kind of depends on it. A typical stay is when you remove both the ovaries and the uterus, so they would not have a heat cycle.
Okay.
Some people do leave the ovaries, and so you will still have some of that hormonal influence, so they may have some behaviors that go along with being in heat. But it just kind of, that's not very common.
Okay. I think I've seen like on the internet where they show like if your animal does this, then it's a major warning sign, where they resting their head against the wall. Is that
Head pressing is a.
head pressing? What does that mean?
It's not good.
Does that apply to cats and dogs?
Cats and dogs, yeah.
But what does that mean? What's going on
It's usually some type of a neurologic issue.
there? Okay. All right. I wasn't sure if it was just wasn't sure if it was true or not, so.
Yes, that actually is true.
Is there anything you should look at if you're gonna get pet health insurance? Is there certain things you would recommend?
So when it comes to pet health insurance, it really depends on your needs. So different pet health insurances, some only cover accident and illness, and so then you still need to be prepared for those routine costs, where there are companies that also cover preventative health care. So you kind of want to know what all coverage that you need. I feel like if you are in a financial position to pay for some of the more routine things, I would look for more just your accident and illness coverage. The other thing that you need to take into consideration is pet insurance is similar to human insurance in the sense that you're going to have a premium as well as a deductible. And so you need to kind of know how much you can afford afford on a monthly basis, as well as what you can afford out of pocket before you meet that deductible.
Is hyperthyroidism something that is common as pets get older
Yes,
For
that's
both-
one of the top 3 diseases. we
for-
see in
for both
cats.
dogs and cats?
Hyperthyroidism, so this overproduction of thyroid hormone is more common in cats. Those guys are gonna be your senior guys that are dropping weight rapidly and have ravenous appetite, so they're losing weight despite still eating a lot. They're usually very vocal. They will have some GI signs, vomiting and diarrhea. Dogs are actually more prone to hypothyroidism, so that's a low thyroid production. And those guys are typically gonna be very lazy. They will gain weight inappropriately. They usually seek out heat. They have some hair loss and some pigment change in their skin.
When your pet starts getting older and you feel like it's getting close to the animal's lifespan is ending, what are some things to take into consideration to help make that decision regarding having the animal put to sleep?
Humane euthanasia and making that decision is definitely one of the hardest that pet owners have to face. It can definitely be a very kind decision that you make for your pet. And some of the things that I encourage pet owners to think about is, what were the 5 things that your pet did that made your pet your pet? And as an example, and this is just one thing, but my kid cat that I had to put down earlier this year, she would meet me in the bathroom every morning, and she would talk to me. She would sit there and ow, ow, ow. And the day that she quit doing that was a huge red flag for me of, she's no longer herself. And so, when your pet is no longer able to do the things that they enjoy and are doing those things that you feel like really make them who they are, I think that is a sign that their quality of life is poor. I also encourage people to have a daily journal where they, on a scale of 1 to 10, if today's a 10, and they had a really good day today, and then tomorrow's a 5, and you take, maybe a week, and you see, are we having more bad days than good days? And that's also, another sign that their quality of life is probably poor. I think it's hard for us to take our own personal quality of life into consideration, but I also feel like that's important. And if your pet's health is negatively impacting you, so you constantly worry about them, you're losing sleep because you're afraid that they're not going to be here tomorrow. I think that if that's your body telling you that it's time and you're just not ready to, accept it. So those are definitely things that I encourage pet owners to look at. There's some great resources. I know we have handouts in our clinic. We have links to things on our website that actually have checklists of things to be looking for at home, things to help make that decision.
I understand that animals are more likely to hide when they don't feel well. So what are some telltale signs to know that before it gets too bad, that, because they tend to hide it so well when they're not feeling well.
They do. Cats especially, unfortunately, usually by the time it's obvious that a cat doesn't feel good, they feel really bad. So it might be subtle things like, they like to sit on a particular perch, so they like to be in the window, and maybe we just were laying on the floor that day rather than up in their typical spot. Dogs, maybe they didn't greet you at the door. They stayed in their bed rather than they come and greet you. Appetite is one of those things that, I think some pets, they just eat. And you can't always judge how they're feeling by if they're eating or not. But certainly if they weren't eating, and just maybe being, more lazy than like you would think as being normal, not wanting to play.
Now, if they stopped eating, how long before it's, like, that you can wait and say, okay, it's just, let's give it a little bit of time. Maybe they're just a little tummy's upset or something, or how long does it have to go? Is it like 2 days without eating? That they be a big red light, a big warning sign, or?
Dogs are a little bit different than cats, so dogs can go a little bit longer. And I also, anytime I have a pet that's not eating, I try and look at the full picture. Do they still feel good? Are they still active and playful and running around? Are they having any other symptoms of vomiting or diarrhea? Because if they're depressed and not eating, and especially having other signs, that would be more of an immediate. I want them to be seen within 24 to 48 hours. Versus if they just skip the meal and they still, feel okay, I'd maybe sit on that for maybe 2 or 3 days. Versus cats, cats are a little bit unique to where they will actually develop a disease called hepatocytosis. And so that's when they will start to deposit fat within their liver, which is sometimes irreversible whenever they quit eating. So it is more important to get those guys seen sooner, within a day, 2 tops. They're not.
What are some of the top misconceptions that pet owners have that you would like to say, here's the truth?
Let's see. The nerves being moist, that really isn't much the difference, moist or dry.
It doesn't matter if it's cat or dog. if
Yeah,
it's
cat or
moist.
dog. Eating grass is a sign of them having an upset stomach. Actually, it's been touched a little bit on that when we talked about the grain-free diet. It is a normal process for pets to graze, so the reason they vomit is because they aren't ruminants, so they can't digest the grass well, but as a normal behavior for them to do that. I can think of some other ones off the top of my head that wasn't prepared for that question.
Okay.
Those are really two.
And would you say that both dogs and cats are, I think a lot of times we think about dogs, we think about how sensitive they are to different smells, but cats are too, very sensitive to smells, so we usually don't think of cats being as much into scent as.
And I would argue that cats are more sensitive than dogs. So we see a lot of respiratory issues with cats when there's certain fragrances, even people that have a lot of essential oils in their house, deodorizers which you put in the litter box. So I would argue that cats are more sensitive to smells than dogs, but they very well are.
Okay. That's all I have.
You touched on nutrition, what an obese pet look like? What kind of volume should you be feeding our pets to make it look like?
The amount of food that you feed is going to be dependent on not only the size of your pet, but also their activity level. So very similar to people, your personal metabolism comes into play, your activity comes into play, and also the food. Every diet's going to be different in the amount of calories that are in a particular food. So if you need a specific diet recommendation, I definitely just reach out to your veterinarian to discuss that.
Is there any tips you give to help prepare my pet for traveling?
Traveling, dog or cat?
Take both. It's going to take both.
So I'll start with cats. You definitely want to get them used to the carrier. And so, the carrier shouldn't be something that they only see when they go to travel. If possible, you want to leave that carrier out. You may use it almost like a crate with you and dogs. That could be, a place that they sleep. Use high reward treats for them to realize that that crate is not a bad thing. And then you also want to kind of gradually work them into travel. So it may be that you start with the carrier and just closing the door for 30 seconds inside the home, and then opening it, letting them out, and rewarding them. You gradually build that up. Start moving them to the car, and then you just sit in the car, and you don't actually go anywhere, and then you come back in, and then kind of build up the time that they're spending carrier. There's also products like Feliway that you can use. Feliway is actually a facial pheromone. And when cats, when they rub up against things, they are depositing facial pheromone on these objects, and that's marking those things as safe. And so you can use Feliway on a towel and put that towel in the carrier, and it just helps to kind of naturally calm them. Certainly some pets, if they're just very anxious, they may need, additional either calming supplements or even pharmaceuticals to help with travel. Dogs are going to be kind of similar, other than they typically don't have, a carrier unless they're really small. But I do the same principles for them, where you want to go slow and just really, kind of build up the time that they're in the car. Make sure you're using high reward treats to make it a positive experience for them. You don't want to just put them in the car when you're going to a veterinarian. Make it fun. And there's also dog pheromone products called Adaptable, and other calming supplements too if they need it.
Does the clinic handle other, I know you focused on cats and dogs, does it handle any other types of pets, like birds or reptiles or?
We don't specifically, so Arrowhead Veterinary Clinic, where I work, for cat and dog only, but there are clinics that do their exotics as well as the larger guys, cows and horses.
Thank you for coming.
Thank you very much, appreciate it.
Okay.